State health officials saying there's no question more measles cases are coming.
This after one confirmed case of the measles here in East Tennessee and an effort now to reach out to hundreds of people potentially exposed to this virus. Last week we learned about that East Tennessee case and we told you how Mississippi health officials had sent out a warning in the city of Hattiesburg about a traveler from Tennessee possibly exposing people to the measles. Well, a new location has now been added and 2 restaurants we've already told you about. This latest addition, the Turtle Creek Mall Food Court in Hattiesburg.
Now, yesterday, our state's health department confirmed it was the same case and told us that the state was working to contact some 600 people because of it.
Well, we wanted to know more, so we had WATE 6 on your side reporter Gabriella Pagan dig for more information to keep your family safe.
There's no question we'll have more cases. There's no question. If you are unprotected and you have more than even a few minutes exposure to someone who has measles, there's a 90% chance that you're going to become infected. So there's no question that we're going to have more cases.
That's after 600 people who may have been exposed to the highly contagious disease were contacted by health department officials.
What we do is after we talk to the individual person, they give us a very detailed timeline, and then sometimes those are known contacts, which makes it easy on public health because we have names and numbers. In some cases, we're looking at security footage in a public space to see who's come and gone within a certain period of time.
Were you in face-to-face contact versus maybe across the room, or maybe you came and left from the same airspace? From there, it is a quest to find out of those 600, how many of them are immune to measles.
For the most part, I think the folks who may have been exposed are generally concerned and appropriately.
Out of these 600 people, do you believe that any of those 600 have been exposed?
So out of those people, those are people who have been exposed, but they've been exposed to different degrees. Depending on what their level of exposure is and whether or not they're immune to measles, we have different levels of concern about them. So we know that we will get more cases of measles because of what we know from the folks that we've spoken to, and that's unfortunate because this is not something that we want to see spread across the state.
Some of those 600 people could be incubating measles for the next 21 days and not know it until even more people have been exposed.
Now, some of those hundreds of people are going to end up being able to prove that they are immune to measles, which Dr. Fiscus says is great. But then there are the people who are unvaccinated not out of choice, but necessity. Those are the people who are either immune compromised, maybe on biologics, or long-term prednisone, people who have had organ or bone marrow transplants, pregnant women, children under the age of 1 as well. You guys both know you have kids. They're all considered an at-risk population, but not out of choice, out of a necessity. That's why it's important. That's why doctors stress, get vaccinated if you can.
All right, Gabriella, thank you so very much. And we need to point out doctors and health department officials have been stressing that vaccinations are the best protection against the measles and that unvaccinated people are at the highest risk of spreading the virus.
If you have any concerns tonight, we have put together a lot of resources for you, including 6 things you may not know about that virus. You'll find all of that posted on our website, WATE.com, under the As Seen On section.